Automatic exposure controls. As radiographers, we have the task to select the best exposure technique in order to produce a good quality image, but more important, a diagnostic image. For that, we use several different equipment and patients with different body habitus too. There are too many combinations of KVP, MA, SID, exposure time, image receptor sizes, grid ratios, etc. When we have to choose the best combination along with patients that have different body habitus and pathological conditions, the selection of the best combination of factors becomes a real difficult task. An automatic exposure control system is a tool to assist radiographers which they can find in most of the equipment they work with nowadays. These are also known as automatic exposure devices. AEC is a system used to control the amount of radiation that reaches the image receptor by ending or terminating the length of the exposure. There's some technique charts that make the radiographer's life easier by giving them the best combination of technical factors to be used in a specific exposure. But sometimes radiographers need to adjust those factors due to the different patient body habitus and any pathological condition they might have. AEC systems determine the exposure time and therefore the total exposure. All AEC systems work under the same principle, transmitting radiation through the patient and convert it into an electrical signal, ending the exposure time. The difference in AEC devices is the type of system in order to convert radiation into electricity. There are two types: the phototimers, that are the first generation of AEC devices used in radiology that use photomultiplier tubes, which are not used today, and systems that uses ionization chambers. Almost all the devices use a set of 3 radiation measuring detectors arranged like the chart you're seeing here. The automatic exposure control device has 3 automatic exposure control detectors on a wall body. The radiographer should select which of the 3 individually or a combination of these detectors, also known as sensors, chambers, or cells, according to the patient's body part that will be x-rayed. The most important element when using an AEC device is the position of the exact body part above the ionization chamber. That is why the most important part of using AEC devices is how the radiographer positions the patient. The most common combination used by radiographers is with the center chamber at the center of the IR. This will place the chamber below the duodenum and transverse colon for the majority of the abdominal examinations, eliminating gastric and bowel gas being placed over the chamber. The left and right chambers are also placed away from the mediastinum and completely within the lobes of the lungs on a chest X-ray. All AC devices allow the adjustment to the amount of radiation necessary to send the exposure termination signal. These controls regulate the IR exposure but often have different labels. AC control labels are -3, -2, -1, 0, 1, 2, and 3. Most labels use the center control as the normal density. In this case, it will be 0, and allow both density to increase or decrease. The density control should not be used to compensate for patient part thickness or penetration changes. The AEC device is designed to figure out this compensation automatically. The AEC will produce a diagnostic exposure for any tissue that is positioned correctly by the radiographer.